First at 6, healthcare leaders in our area are bracing for the potential of what they call a twindemic.
As COVID cases surge, doctors are also keeping a close eye on the flu, which could further tax hospital staff.
WRTV's Megan Sanctorum is live downtown finding out when you can start getting a flu shot and why it may be more important this year than in years past. Megan.
Yeah, good evening, Amanda. Well, it's hard to believe that flu shots are already here, and doctors say you should start getting them now. Many major pharmacies like the CVS here behind me have already started offering the flu shot to the public, and they say protecting people against the flu this year is very important to preventing a twindemic with COVID-19 and overwhelming the already busy hospitals in our area. Now, the flu shot is a one-dose vaccine. It's updated every year to protect against the strains that are predicted to become the most prevalent. According to the CDC, this year's shot will help protect you against 4 different flu viruses. The CDC is recommending it for everyone 6 months and older. Health leaders say it's tough to predict just how bad the flu season will be this year, but they are expecting a major increase from last year. Take a look at this chart from the Indiana State Department of Health. That blue line at the bottom was the number of patients with flu-like illnesses in emergency departments and urgent care clinics for the 2020-2021 season. You can see it was much lower than years past. Health experts say that was because people were really paying attention to personal hygiene, wearing masks, social distancing, and avoiding large gatherings due to the COVID-19 pandemic. Many people are beginning to return to pre-pandemic activities now, giving the flu a chance to spread again. Health leaders say people often avoid the flu shot because they're worried it will make them sick. But they say that's not the case. While you may experience some slight side effects, they will be nowhere near the extreme symptoms you could experience if you were to catch the flu.
That's a common misconception, I would say, that people think that they could catch the flu from the flu shot. So the first thing I would say is the flu shot is not a live vaccine. So there's no live flu in the flu shot. Sometimes people do get flu-like symptoms after the vaccine, and that's normal. That's your body's way of responding to that vaccine and saying, oh, there's something here I don't recognize. And then hopefully you'll have some of that immunity later if the flu actually were to present itself, and prevent you from getting sicker than you would without the vaccine.
And that in turn will help prevent the severity and duration of your case if you do catch the flu. Amanda?
Megan, just earlier this week, we spoke with you about hospitals in our area being overwhelmed with patients and a lack of staff, many having to go on diversions recently. Is that something they're worried about and may continue as we get into flu season?
Yeah, that is a major concern right now. You know, COVID-19 and influenza are both respiratory illnesses. So health experts tell me that people who end up in the hospital for both of those things may end up needing the same type of care, the same type of resources, and it could really overwhelm our hospital system. Now, we did speak with a medical expert earlier this week about what could happen if people don't take steps to protect themselves from both of those illnesses.
I think we could end up in trouble, to be honest. I think that, having COVID and influenza at the same time is possible. Co-infections are possible. And we could expect to see hospitalizations to increase. We would expect to see more people being admitted into the intensive care unit and maybe, unfortunately, mortality increasing as well.
And so again, they say the best way to protect yourself against both the flu and COVID-19 is to get the vaccine. The sooner you get the vaccine, the sooner you'll be protected. Back to you.
Our Megan Sanctorum live for us tonight. Megan, thank you.